Good afternoon once again. Monday, the 11th of October 2021, and this is the English language summary of the press briefing here at the Center for COVID Situation Administration in Thailand here at CCSA. So thank you, Dr. Apisamai, for the Thai language briefing. We had a very good meeting this morning at the daily CCSA meeting, wherein some proposals were discussed to be proposed to the general CCSA meeting, which will be held next this coming Thursday. And some of these proposals include the relaxation of some measures in particular provinces or recategorizing some provinces in the strict and controlled zones. So we'll see how that goes. Of course, according to the situation that we continue to monitor in a very detailed way each and every day. So firstly, starting off with the global trend. We still see a continuous downward trend globally in the newly infected cases. In Asia in particular, while the trend in the country of Myanmar is remaining stable, most of our neighboring countries are now seeing lower numbers in new cases as well. For Thailand, overall, we see also a downward trend for most provinces in Thailand. And I have a graph on screen for you. So you can see the blue, green, and orange lines. Looking at the blue line, we can see that the Bangkok metropolitan area is doing quite well in terms of reducing the number of newly infected cases. As you see the dark blue line going on a downward slope there, as well as 67 other provinces represented by the green line. Now, if you look at the orange line representing the provinces in the deep south, the southern border provinces, we can see that the number is slightly going up. So therefore, the government agencies are exerting more efforts focusing on the deep south to curb this trend. The CCSA meeting today also reviewed development in the past 2 weeks and discussed further measures that we can relax or not. This will, of course, be finalized at the general CCSA meeting this Thursday, the 14th of October 2021. This meeting will be chaired by the Prime Minister of Thailand. And as mentioned, the 1st of October was the period that we set that we will be monitoring the efforts, the implementation of measures, and the trend in the coming 2 weeks, which of course will be ending on the 14th of October, the day of the General CCSA meeting. Also, Dr. Apisamai's Thai language briefing, there was special mention made on the death toll since the month of April, wherein data shows that 60% of deaths since April are those who did not receive any vaccines, while 19% of those who received 1 jab of vaccine and people who received full 2 doses made up less than 1% of the death toll. So therefore, reading between the lines, of course, it's very important. The most important message of today, of course, is on vaccination, where most of the deaths in Thailand are from those who have not received any vaccine at all, and only a very small percentage of fatalities for those who have received either 1 or 2 doses of the vaccine. I'll look at the update for the numbers of vaccination in Thailand, according to our drive now, administered since the start of our national vaccine drive since February 2021. Yesterday, we administered 688,481 doses of vaccine, increasing the accumulated number of vaccinations in the country to over 60 million doses already. To be exact, you see on screen there, it's 60,228,105 doses. Now, in the detail of that, we have the first dose and the second dose. You see that on screen, wherein over 311,000 people received their first dose yesterday alone, while over 345,000 received their second dose. The total administered yesterday alone was over 688,000 doses. Just happy to report that since Friday's briefing on the goal to inoculate 50% of the population in every province, we have now Rayong, the province of Rayong, as the 14th province to meet this 50% target of people being inoculated in that province. So that's the 14th province. On the goal of inoculating 70% of the elderly population in every province, we now have 8 provinces that have inoculated more than 70% of the elderly population already, namely Bangkok, Pathum Thani, Chak Cheong Sao, Chonburi, Phang Nga, Phuket, Ranong, and Surat Thani. As for the general situation and numbers we have for today, we have a screen coming up for you there. We have new confirmed case at 10,035. We have new recoveries in a close number at 10,590 cases. We have active cases still being treated at 110,265 and 60 fatalities recorded for today. The fatality rate remains at 1.03%. So as mentioned last week, we were at a crossroads where our strong will and endeavors, of course, may help flatten the curve. So therefore, it's very important to strictly implement all of the recommended safety measures, including, number 1, vaccine coverage, number 2, universal protection, number 3, active testing using ATKs, and number 4, COVID-free settings to realize our reopening plans. In short, never let our guard down. And you have a graph there for you where the current situation is in the circle, and of course, with the COVID-free setting on where we can go to the better. So just before ending this briefing, I'd like to take this opportunity to highlight that yesterday, the 10th of October, was World Mental Health Day. As you recall, we talked about mental health quite often. Yesterday was the International Day for Mental Health, Education and Awareness. Of course, the pandemic has been a big part of our lives in the past almost 2 years already, and had an impact on the people's mental health globally, including children as well. So therefore, it's important for us to take a break and keep your mental health in check from time to time. If you feel stressed, you may find that talking to someone close to you that you trust may be helpful. If you see your friends struggling, please offer them help. And by all means, do seek help from a professional should you find that you need one. So with that, I thank you for your attention. We'll see you again on Thursday, the 14th of October, after the general meeting of the CCSA, which will be chaired by the Prime Minister of Thailand. Thank you very much for your attention. Please stay safe. Sawasdee krap.